Women have been giving birth for centuries, so it's a pretty natural experience, right? Wrong. I'm Stephanie King, professional doula, childbirth educator, and the creator of the My Essential Birth course, the online childbirth education course that's helping women everywhere confidently achieve their best birth. Today's culture would have us think that birth should be treated like an illness or an emergency, and that most of us need other people telling us what's best for our bodies because we aren't the experts. So sit tight, because if you're tuning into this podcast, you'll probably start to believe in your body, your intuition, and find yourself empowered and confident to do what it takes to have the birth of your dreams. If you like listening to me take you through these weekly topics step by step, then you're going to love the My Essential Birth course. Make sure that you're subscribed to the podcast and definitely head over to myessentialbirth.com for the free downloads mentioned right here in these episodes and to join the birth course and community full of pregnant moms just like you. I have to add a disclaimer that I am not a medical professional and I cannot provide medical advice. All of the information expressed in this podcast are based off of personal, professional, and educational experiences and are my own opinions. Please work with a provider you trust for medical advice during your pregnancy and birth. Okay, it's time for another reviewer of the week, and this one is, I'm probably going to butcher it, it's Bejomo. I don't know if it's Behomo or Bejomo. I'm really not sure, but she left a review, and she left it on, it showed on Valentine's Day, so I felt very loved by this review, so thank you. She says, seriously good info no matter how many births you've had. I'm currently pregnant with my third baby and stumbled on this podcast, and I'm so happy I did. I am planning for my first unmedicated birth, and I feel so prepared and confident after listening to, actually binging, these episodes. I went back to the beginning, and I'm working my way through all of them because the information is so good, and the host is so fun to listen to. I actually ended up buying the course and am loving it. But even with just the podcast episodes, you get such a wealth of knowledge to be prepared for any birth you want. Highly, highly recommend. Thank you, whoever you are, with your awesome name. I really appreciate it. I'm so glad that you are loving and binging and doing all the things. I have to tell you guys, when you leave reviews like this, it makes me feel really grateful to just be even the slightest part, like the tiniest little part of your birth story. Because I know that like everything that we listen to, everything that we consume becomes just a part of our birth story. So I'm really, I want you to feel the gratitude and the love I have for you for being a part of that. Okay, let's jump into this week's episode. I have with me here, her name is Kayln. She is a gem. I love her. I know that you guys are going to love her. But when she originally reached out to me, I had no idea what she did. I was like, just fair. Occupational what? Say that again. Also, why don't I know about these? So without further ado, I just want to kind of jump in, and she is an occupational therapist, and I want her to introduce herself. So take a moment, introduce yourself, your family, everything, and then we're going to jump into this topic a little deeper so that we can talk to pregnant and birthing women about this very important information.
Yeah. Thank you so much for having me today, Stephanie. It's really an honor, and I've been listening to Stephanie's podcast when I was pregnant, so it's just really cool being here and in the studio and seeing it in real time.
Yeah.
So I am an occupational therapy student. I grew up in Maryland. I'm the oldest of three siblings and just grew up very close to my parents. I would attribute the way I am today because of them. I attribute who I am today because of them. And grew up very active, hiking and camping and doing all the sports. And then I went to undergraduate, got my Bachelor's of Science degree at James Madison University. And for those of you who aren't familiar, it's in Harrisonburg, Virginia, surrounded by the Shenandoah Mountains and Blue Ridge Mountains. And it's beautiful. And that's where I absolutely fell in love with the mountain ranges and doing everything outside. And that's where I met my husband. And we both enjoyed doing everything outside and hiking and camping. And that's where I fell in love with occupational therapy, and I knew I wanted to pursue that as my career. I took a year off and I worked for Johns Hopkins as a rehab aide and worked at a local hospital, and that's where I was figuring out where I wanted to go to college and pursue this degree. I knew I didn't want to be in Maryland, but I didn't know what state or what region I wanted to be in, and I ended up choosing Montana, a program called Rocky Mountain College, a doctorate of occupational therapy program in Billings, Montana. And it was the biggest jump I've done in my life because it's the furthest I was going to live from home. But I absolutely love the past 2 years I had there. That's actually where I also had my son Lincoln, who's now 4 months old.
That's awesome.
And yeah, now I'm here in Utah. My husband and Lincoln and I moved here to Salt Lake, and I'm doing my clinical rotations and finishing up my last year of graduate school before I get my doctorate in occupational therapy. And we're here for the foreseeable future.
That's awesome.
Yeah.
I'm happy to have you here. It makes me curious. What were you taking in school that brought you to occupational therapy? Was that like from the beginning you knew this term and that's what you wanted to do, or?
So I became familiar with the term in high school, but I still wasn't really sure what I wanted to do in high school. I knew I wanted to work in healthcare, to help people some way, somehow. But it wasn't until I went to James Madison University, I was part of a club called Overcoming Barriers, and I worked with, the club stands for they pull in people from the community and they pair you up with them, and you work with them for, I think it was about 6 to 8 weeks, and you just work on the goals that they came in with. So for the young lady I was paired with, she was a 21-year-old young lady. She had Down syndrome and she was wheelchair dependent. So her mom was really concerned about her quality of life and being able to leave the home in case of an emergency. So we worked together through our time. I got to know her, figured out what motivated her, and she made significant improvements, and she was able to walk 2 sets of stairs just by holding on the railing without my assistance.
Wow.
And just that experience with her made me realize like how powerful working in rehab and therapy can be.
Yeah.
So that's where I knew I wanted to go that route. But occupational therapy resonated more with me just because it's so client-centered and you bring it back to the function of the person and addressing activities in daily life. And
okay, so yeah, will you expand
go
on
right
that?
into occupational therapy.
Tell me about occupational therapy.
Yeah. So
kind of like
the way
broad,
I describe
and then
it,
maybe bring it back, because I want to make sure that we're talking about pregnancy and birth and all of that too in the postpartum, and what you do specifically. But I know it's this like broad, right? Like it covers a lot of things.
Oh yeah. And a lot of people don't know what occupational therapy is. So like, that's why I love being here today and talking about it, because the word needs to get out. And I think a lot of people, I'll get into it, but a lot of people just see it in like one light, and we cover such a huge realm. So the way I describe occupational therapy is it's a holistic approach to healthcare that helps individuals get back to doing activities of daily living and meaningful things in their everyday life. So by holistic, what do I mean? And we focus on the whole person. So the brain, musculoskeletal system, we don't just focus on where's the problem, what's the condition, how do we treat it? We focus on, okay, what are environmental factors that impact this? What are social factors that impact this? How is the mind impacting this? Spiritual factors. And we just encompass the whole person in this holistic lens, which is what I love so much about it. And it looks different for each individual because it is client-centered. Our approach is different because it's whatever that person wants to address. So for example, occupations are things that consume your time day to day. So that could be getting in and out of bed, going downstairs to make food, prep meals for the next day, driving to work, socializing and communicating with family and friends, hiking, getting outside. It could be anything that consumes your time, really.
Wow.
So it's very vague in that sense because it could be anything, right?
So what are you specializing in?
Yeah. So right now I am working, my first fieldwork rotation, my clinical, is with early intervention. So that's working with babies 0 to 3 months, and we help them create or hit their milestones and make sure that they're on track developmentally for the rest of, their growth and development. And there's not one specific condition that we focus on or that we see in this age group. It can be anywhere from a baby that's born premature, a baby that's born with cerebral palsy or has any medical diagnosis, or maybe they're just developmentally delayed. And it's a family coaching model. So we help the parents, and we're in the homes. It's very intimate, and we help coach the parents through the next steps and how to progress and encourage their kids to get to that next step.
Reminds me of dog training. They were like, the training's not for your dog, it's for you.
Yeah, right.
Yeah.
Right.
That's awesome. Okay, so early intervention, and it kind of makes me wonder, well, and my first question for you, I think, was like, well, first of all, like, why don't people know about this?
Yeah.
And how do they come to know about it? Like, who ends up getting offered occupational therapy services?
Yeah.
And how?
So it just depends on the setting. Because we work throughout the lifespan. We start as young as a premature baby in the NICU, all the way to helping with end-of-life care with the geriatric population. So it really does vary on the setting that you're in, the population that you're working with. But a lot of times occupational therapy will be an automatic referral depending on your diagnosis. So, for example, if someone has a hip replacement, you automatically will see an occupational therapist in the hospital before you go home.
So how's that different from physical therapist?
That's a great question because people ask that all the time.
I feel like are you a doula or a midwife?
Right. Yeah, so different. Yeah. So physical therapy, I would say, focuses more on building the strength, increasing range of motion, and versus occupational therapy encompasses that a little bit, but then it also focuses on, okay, in order to do what? So in order to, what would you like to get back to doing? Oh, I'm a rock climber. I really want to get back to rock climbing. Okay, so that's what we're going to focus on. And again, that depends on the setting that you're in. So if you're in the hospital, things that we focus on are getting out of bed, toileting, hygiene, brushing your teeth, eating. With babies, like I'm doing now with early intervention, we focus on the milestones, making sure that they're feeding themselves, making sure that they can nurse properly, making sure that they're crawling, walking. And then a lot of it is incorporated with fine motor play. But I would like to touch on is it's not just working with the hands and the arms and the upper body, because I feel like it's often a stereotype that our field has, just working with the upper body, but we do more than that, but that is where we focus on the fine motor. We also work on gross motor. But.
So do people come to you if and only if there's an issue?
So yes and no. It's dependent on the state and your insurance coverage. So most of the time you will always need, in order to seek occupational therapy services, you'll need a referral from a primary care provider or a doctor. So they need to believe that they can benefit from services from you in some way, somehow. So does it necessarily have to be a diagnosis? No. Or an injury? No. But it has to be a referral, a reason that the doctor thinks that we should see them. So it couldn't be anybody, could just come to us. We don't have that capability yet. We don't have direct services.
Yeah.
Hopefully one day we'll get there.
Yeah.
But no, it has to be a direct referral from a doctor.
So could a mom go to a pediatrician and request services from occupational therapy?
To my understanding, yes.
And what would some of you can't answer this because I'm sure it's case by case and city by city and whatever else. But
right.
What are some of the things that a mother could request services for?
So there's
some examples.
Yeah, there's a lot of ways that occupational therapists can help mothers.
You even mentioned like breastfeeding.
Yeah.
And so it makes me curious because I hadn't even heard of an occupational therapist. So like if I wanted to request services, what do I need to be working on?
Okay. So again, it depends state to state, right? I can't preface that enough.
Right.
And what insurance will reimburse for. But some of the things that we can address, especially for the motherly population, postpartum and during pregnancy, is posture for bottle and breastfeeding, musculoskeletal disorders or conditions, ergonomics, self-care, mindfulness, mental health. Postpartum depression is a really big one.
Yeah.
Sleep, roles and routines, especially how that will change with new moms transitioning to that role, because as we know, your lives change forever. Adaptations and compensations to support these changes. We can also help with splinting for certain conditions like carpal tunnel, which is in the wrist, and that's a very common condition that we'll see that comes up with moms because you're holding your baby now and you're using your wrist in ways you've never used before.
Yeah.
And then specifically with babies, care for babies after delivery, the feeding, whether it's breastfeeding or feeding them with food, supporting their developmental milestones, like I said, and then sensory strategies to help promote a maternal-infant bond. That's huge.
So would a mom, I'm curious, if a mom is suffering with postpartum depression, for example, and goes to her OB provider to talk about this, is that where this conversation of occupational therapy could come up?
To my knowledge, yes.
Okay.
And are there scenarios where maybe that individual would be better served with a psychologist? I don't know. So I don't want to speak definitively.
I feel like if we're going to talk about it, I want women to know that they have the option, because I feel like a lot of the times, myself included, going to a provider and talking to them about I'm having these issues gets pushed towards psychiatric or psychologist or medication, versus like what you're talking about, this whole body approach, a more holistic, like what if I wanted to try that rather than aiming for the medicine. So I just wondered, like, how would a mom get there? You know?
Definitely. The first step would be talking to your primary care provider about it and seeing, again, depending on the state you're in, it's not a very, it's a very non-traditional area for OTs to be specialized in, working specifically to address mental health for moms. It's out there and it's 100% absolutely within our scope of practice, and we address it.
Yeah.
But in terms of finding that specific therapist in a specific setting that will address that solely, that might be limiting to find that exactly. But if you're seeing, for example, if you do want services with feeding, breastfeeding.
Sure.
And that, because for me, that was a huge mental health barrier for me. I really struggled with that. You can go through early intervention services, and that is provided in every state. It varies state to state what they provide with reimbursement, and whether it's through the school system or an outpatient clinic, but that is available everywhere. So you can go through them and request OT through that. You have to get an evaluation and everything,
and that sounds like goes through pediatrics. Is that correct?
It depends. So in Utah, it's under the Utah Department of Health. Okay. So it depends on what state you're in, on who they're through.
But would it go through your pediatrician? Like if you're talking early intervention, you're talking about babies.
It goes through insurance specifically.
But would a pediatrician be the referring party?
Like if not for early intervention, because anybody can get into early intervention.
So what provider do you need to go to get the referral? You know what I mean?
Well, for early intervention, at least for the state of Utah, my understanding is that you don't need a referral to get into early intervention services. But for like an adult to see an occupational therapist, you would need that referral piece.
This is stressful.
It is so confusing. It is so confusing. But when we are working with women to address anything, whether it's specific to a carpal tunnel or whether it's specific to feeding their baby, our lens as occupational therapy is that holistic view where, okay, let's talk about your routines. Like maybe there's something in your routine that we can change to help with this specific pain. Maybe there's something, maybe it's the positioning that we can help with the breastfeeding. Maybe it's the timing. Maybe it's the environment. We can dim the lights or something Yeah. So it's very confusing.
I love it though. And I'm hoping, I will put links if you can provide them, at least for Utah, since that's what you're familiar with. So in the show notes for the podcast, I'll make sure to have links at the bottom. So if you're local to Utah, you can at least grab some of those and get some information. I love that. And you kind of talked about some of the resources that you provide. So say that early intervention, what ages is that for baby?
That's 0 to 3.
0 months to 3 years?
0 to 3 years. Yeah.
3 years. Okay.
So from birth to 3 years.
Okay.
Yes.
So some of those early intervention things. But then I love that you talked about this whole body. So there's you include self-care and you talked about mindfulness. Do you want to touch on a couple of those things that go along with that?
Yeah, absolutely. So I think that's such an important part of where OTs can help moms, is with that mindfulness, whether you're struggling in your pregnancy, through your journey, or whether you're struggling afterwards with the baby blues. Those are big things that we can address in terms of what's causing that. And again, we break it down we break down the routines throughout your day to see, okay, where does maybe a potential issue lie, or where can we implement an adaptation or a change, or support. So I think it's a big area that we can help in, but it's not well researched, and there's not a lot of talk on it.
Right.
And there's not a lot of women who address that out there, but I think it's very important.
I'm with you 100%.
Yeah.
Yeah. I think, I don't know, as you're talking about this, it makes me think of moms, and there's a transition that happens whether or not you go back to work, right? So transition from like no babies to I'm home with a baby all day and breastfeeding and trying to figure out sleeping and washing yourself and everything. But then too, I like when we're talking about these like bigger life changes too, or transitions, I think of moms who need to figure out how to get their baby on a bottle, produce enough milk, find enough time for sleep, childcare, making it back into the workspace, like there's like a whole slew of stuff there. And so it sounds like occupational therapy is something that can help that transition.
Oh, absolutely.
Yeah. And that's huge.
Yeah.
Like if I had somebody holding my hand for that transition, like, wow, I don't know. That's the difference between sinking deeper into something like postpartum depression or being able to breathe. And that's huge.
I know. So. And I so wish that it was a part of like standard care right after. That would be awesome.
Like, wouldn't it?
I think,
like, if
I
it
think
was
that
part of that first 6 weeks.
Absolutely.
Yeah.
Absolutely.
At a minimum.
And that's where it's tough too, because if you're in the hospital, you wouldn't see an occupational therapist in the hospital unless you went through some sort of injury or a very complicated birth, or you were in for some reason that you'll need to recover in a way when it comes to rehabilitation. Yeah. So that's where it's tough. Like where can you find that? Like, this sounds great. It's awesome. And I so wish it could be a standard of care afterwards. But at a minimum, I think it's just great to get the word out and tell people like how we can help them in terms of having that mindfulness piece. And then the whole transition with the routines and everything. It's just such a life-changing event. And I mean, at least I felt like a completely different person because you adopt this whole new role. Yep. So it's definitely an area that I'm passionate about, and educating people about, and hopefully one day like to serve. Yeah. Yeah.
Okay. So this is kind of like off the outline here, but are there things now that you've done some of this and you've seen early intervention, you've had your own children, if there were kind of like a checklist, I don't know if like head to toe is the right way, or if it's like do this first and then this, looking at new moms who have had new babies now, are there things that stand out to you that like moms need to have focused time, energy, effort, or information on these things consistently? I see this with all of my patients, or I notice this with myself. Are there things that stand out consistently for you?
At least in my experience with me personally, I just think that knowing that it's different for every person. So I feel like it's really hard to give that one size fits all like checklist. But I think there was a lot for me with not knowing how it was all going to go. Yeah. So I think having that clarity on, okay, I know I'm going to have to breastfeed. I want to get education on it. Yeah. I think that would have helped me a lot. Okay. I know that I'm going to lose a lot of sleep. How do I cope with that? Yeah. Or like, how can I help find ways to make up sleep in other ways?
Or what support systems do you need to have in place?
Right. What supports? And then I think a huge thing for me, and my midwife really drilled this in our head before they discharged us from the hospital, was just open communication. Yeah. And just whether that's a friend, whether that's a partner, whether that's a family member, or somebody in the community. Yeah. I think that relatability piece with this new role, that for me, that was huge. And I think a lot of people might feel alone out there, and like it can be very isolating. Yeah. Not knowing, is this normal? I don't know if this is normal.
Never mind the pandemic.
Right. I think those would be my main things that I would say is the communication part is huge. And just being prepped. like step by step, the breakdown of, okay, the breastfeeding, if that's something that you want to go into, because that's not for everybody.
Or if not breastfeeding, what does bottle feeding look like?
Yes, because that's a whole nother thing, like what
and
size,
not just
what
the
bottle.
cost. Yeah, like the other things that go
the
along
formula,
with it. How long are you going to have to be up with them at night still and on all of that?
Yeah. And then I would probably add in there too, that maternal infant bond. I think I had a lot of education and understanding on that going into my experience because of my schooling, but that's something that a lot of people don't all have. So I think that's something I wish I could give to moms, is that the education on that. And it's anywhere from communicating with your baby hours that they, have been brought into this world, and connecting with them with touch, and just being able to care for your baby in that way. And I think once that maternal infant bond is made and it's strong, not only does that help the child's development, but it also helps mom's mental health.
Sure.
If mom feels confident, she's going to be great at caring for a kid.
Yeah.
So
I think that's a great point too, because we have a lot of this I see, and this was my experience as well, when you have a cesarean birth or you have any kind of like NICU state or something that separates mom and baby. And I've mentioned it on here before, but they've done studies which were actually really interesting, like, and like even animals, right? Like you remove the babies from the mom, and a lot of times she won't take them back. I mean, she'll straight up kill them, this is not my baby. And it's the same with it's not just oxytocin and stuff, right? But that's part of it. But like you talk the skin to skin and the touching and the like communication, like you're talking to your baby and you're listening to those coos back, and all of this helps us to form that relationship with our baby, which helps us be a better mom.
Absolutely.
And when you have that little bit of a gap where babies are taken away, then it could be a little bit more work, but that work needs to happen.
Absolutely. And the education on how important it is,
I
think needs to be shouted from the rooftops. It's not talked about enough.
Right.
And there are a lot of studies, and that was something I researched a lot when I was in school in Montana, was that timing, even in the NICU, like requesting, can they do this with me holding my baby? Can mom be a part of that process somehow?
Right.
Let's incorporate mom some way. Okay, if they need a feeding tube, can mom be a part of that somehow and feel that she's still providing for her child? Right. Somehow incorporating mom in that process, because it is so stressful. Yeah. And it does I think at times it can set the stage for that for relationship
months or years down the road. It's very real. Those bonding, the bonding at the beginning. And I love that you just talk about even just being present or part of it. Yeah. Because I wish I could find this. I remember reading early on into like my birth stuff that mom and baby is so connected. Like they've studied their brain waves after birth, like baby's not in the belly anymore, and their brain patterns match while they're sleeping. Like exactly match. And you're like, you don't realize how connected you are. And then if you're completely pulled away from that, like no wonder you're feeling lost as a mom. And imagine what that little baby, babies, they need to be held and loved, and we need that as adults, dang it. So.
I know. I know, right? Yeah. I still need my mom.
I know. So it's huge. It's huge. I love that you're talking about this. That's awesome. Will you go into a little bit about, we talked about mom and kind of the help postpartum. We mentioned babies a little bit, but early intervention, and you maybe specifically about newborns. You talked a little bit about breastfeeding, a child development, milestones, that kind of thing. Is there anything else that you do with babies or newborns?
So there's some additional certifications occupational therapists can get. Awesome. One of them being infant massage. So
I love this.
Which is so cool. Yeah. And that goes back to that maternal infant bond and that connection. And
do you have the massage?
I really wanted to get it. That was something I wanted to do, like finishing up my year before I graduate. And I don't think it's in the cards for me right now, but I think it's something I see myself doing in the future, because if I could coach moms and caregivers on how to do that and, make that connection, it can help with things such as torticollis, which is the tightness in the neck, which can cause many other things down the road. It can help with feeding. It can help with digestion, gas. It can help with just calming baby down. So I think that is a really cool piece that we can help with infants. And then the feeding is huge. Yeah. Even if it's beyond the breast and bottle feeding, now introducing solids, because that's stressful in itself. Yeah. So we address that a lot and help with that. And if a child has any feeding disorders or conditions, we address and help with that too.
I love that.
Yeah.
And then you talked too that you can also take on some lactation certification.
Yeah.
And so that makes me curious because I know I'm a big proponent of like find yourself an IBCLC.
Yeah.
Right. So like go to the master if you can. But if you're receiving care and it's for all of these things and maybe it's not something that needs to go directly to an IBCLC,
right?
What a benefit to have
Absolutely.
somebody that can help with just basic knowledge for these things.
We just had a mom come in the other day that she was seeing an IBCLC for a while. It got too expensive. So that's when someone mentioned early intervention. Oh, why don't you see an occupational therapist in early intervention? It's more cost effective. And they come into your home. They can also keep an eye on your baby. So it is kind of like a...
good to have both.
To have it all. And sure, there are things where we'll have to refer out. And
that was going to be my next question.
Yeah.
Or like next point. So on top of the fact that you guys are very skilled, when there is something that needs more specific, a specific place to go, you guys are also like crazy good for resources, correct?
Yes. Okay. So, and that's what's great about working with your kids early too, and working with moms. Because even I know, speaking for myself as a mom, like I am always worried about any little thing, right? So even if you're concerned about something and maybe your occupational therapist can't provide that service because it's not within our scope, yes, we can refer out to lactation. We can refer out to special physical therapists. We can refer out to anything with like the gut, like GI stuff, or like working with fitting orthotics for, feet, for shoes. So yeah, I mean, there's a slew of resources that we can provide in that sense. And again, that also varies state to state. Like something we would talk about is the La Leche League, but that's nationwide.
Sure.
Something that is state specific that first comes to my mind is in Montana. Actually, some of my classmates came up with a program called Cuddling Cubs, and it helps moms who may be feeling isolated or want more information as they transition into that new role on how do I care for my baby and what are some things I can do with my baby. So Montana offers Cuddling Cubs, and I'm sure there are other states that offer programs such as that, but it does vary state to state.
Yeah. But I love that. That's something that we are asked to do as doulas, right? And like any good doula will have incredible resources, right? Like childbirth education or lactation consultants or I would hope now occupational therapists nearby, but physical therapy and pelvic floor therapists. I mean, just the list goes on, mental health, all of that. And so I love another resource that also has good resources for mom. I think that's really solid. Yeah.
So another area where you can get an additional certification as an occupational therapist is in pelvic health. In addition to lactation, you can become a feeding specialist, pelvic health therapist. There's, again, like I said, the infant massage. There are perinatal mental health providers as well. Wow. And again, it's just, they're very specific, like specialized, like unique certifications. And I think it would vary on where you could find them. But it's definitely within our scope, and having that additional certification can help moms that much more.
So are there tons of occupational therapists everywhere? Like, does every hospital have access to them?
Should.
Yeah.
To my knowledge, yes. To my knowledge, yes. Hospitals have them, and we are in schools, hospitals, outpatient clinics. We come into your home. We do home health, early intervention, which is through the school system and the Department of Health, depending on the state you're in. But yeah, we are all over the place. But in my opinion, there's not enough of us.
Yeah. Well, if I didn't even know about it.
Yeah.
Right?
Yeah.
Okay. Tell me about the best part. What's your favorite thing, best part for what you do?
There's so many things I love. I think my favorite part, just in general with occupational therapy, is that it's so, because it's client-centered, it's so different for each person you work with. Yeah. And there's not like a one-size-fits-all for like a treatment approach. So you're always thinking on your feet. Like you have to be creative. And through that process, you're also building this like really intimate relationship with somebody, because the things that encompass your daily life and activities, I mean, some of that is like intimate, like hygiene, you know, and
Right.
getting in and out of bed, your mental health, and you build a really close relationship with your clients and your families, and I love that so much.
I like that too.
So I really value that, and especially right now working in early intervention, being in the homes is so cool.
Yeah.
Because you're not in the clinic having to think, oh, how can the kid use this tool in the house?
Right.
Do they have this tool that they can practice with in the house? You're using things and resources in their own home to make adaptations and changes and help them grow.
Yeah.
Which is really neat. And you're growing with the kid too, which is so awesome.
Yeah.
And watching them develop is really cool to me.
That's neat. I have to bring it back to birth because
Yeah.
I'm like, it reminds me of doula work.
Mm-hmm.
That's my favorite part, is like you go to a provider and they're actually, I don't know if you guys know this, like doctors are not supposed to form close relationships with their patients because it can mess with their ability to treat that patient.
Oh.
And so it's actually like a rule, like you can't. Anyways, even for like a home birth midwife, if I have like a friend and I want her to be my midwife, like it would not be appropriate for her to be the only midwife there because she knows me very well. So she has to have a second midwife. Like anyway, so there's this kind of space that has to be respected so that they can have that decision making. But as a doula, that's my favorite part, is it's like, no, this is exactly about you and we're going to form this relationship. And just like you said, it's you know, not every birth is going to be the same. Not every mom's going to need the same things. And so it adapts that way. It's kind of that holistic approach. And all of it is bringing me back to like doula work, seriously. Because even in the postpartum, when we're talking to moms, it's like, I do from head to foot. This is why that came up for me when we were talking this evaluation, like top of your head, like talk to me about what you're thinking right now. You know, what's going on in your mind. Tell me about your birth story. You know, we're going to take it all the way down. Like, what are some, you know, do you have positive people in your life? What are you hearing? What are you, like, food? What's your nutrition like? Take it down to the gut, like all the way down. How's your bleeding? But it's that whole, it's not just about the physical body, right? It's, and how's your spirituality? How are, you know, what are you doing for you? Self-care, all of that, sleeping. And I think that super matters. So like, that's awesome. I think that doula work exists because that's my big thing, right? Because a lot of, especially here in the United States, we have our babies and we don't see our provider for 6 weeks. A lot can happen in 6 weeks. A lot of terrible things can happen in 6 weeks that need to be addressed, that if they wouldn't be so terrible. And it sounds like it's the same with occupational therapy. And when you're talking about early intervention, it's like there's a lot of things that can happen here that if we get it quick, we're on top of it and we've got a way better outcome. So what a beautiful thing.
Right. Which is why I want to push so badly that would just be a standard of care. Following you through, just even if it is that 6 weeks. I think that is such an important time that we can help.
I agree.
Because even just going from the hospital to home, I mean, in itself, talk about a transition.
No kidding.
Holy smokes.
I'm like, you trust me to keep this baby alive for real?
Right.
I don't know what I'm doing.
Right. Right. You can read every book out there. You can listen to every podcast, which yours is awesome.
Thank you.
Helped a lot. But it just, nothing will prepare you for that moment. And
second baby though, do you feel a little better? You're like, oh, I can keep this baby alive. I'm good.
Maybe. I'm not there yet, but we'll see. But I think we could really benefit with just that time. And that's why my classmates created that Cuddling Cubs program.
Oh, these were classmates?
Yeah.
That created a program? I love this.
Yeah. And unfortunately it isn't only state in Montana. It's only in Montana, but that's why they created it.
Franchise.
Yeah. That's why they created it, because so many moms go home and like, what am I doing?
Yeah.
I need help.
Big time.
And I think that's another hard part, is like the asking for the help.
Yeah.
It's not always there. So now that just getting the education out there and like what occupational therapy is, people can advocate for it, talk to your primary care about it. If it seems like something that would be helpful based on the things that we can address. But I think that transition piece is huge. Yeah. I mean, it changes your whole life.
Yeah. Forever.
Yeah.
Well, thank you so much for your time today. Thank you for introducing me to occupational therapy so that I could bring it to all the listeners here. I really appreciate your time.
Yeah. Thank you. Thanks for having me.
That's it for this week, but make sure you subscribe to the podcast so that you get notifications first as I drop a new episode every week. And don't forget to head over to myessentialbirth.com for all of the free downloads mentioned here and to join the birth course and community serving pregnant moms just like you. If you enjoyed this and other episodes, I would love it if you would take a few minutes to leave a review on Apple Podcasts. I read every single one and include one at the beginning of each episode. See you next week.